Thank you, Mashudu. Thank you very, very much. And a big virtual round of applause to all four of our speakers, to Professor Mg, to Dr. Sarona Fasahi, to Mr. Lupiwo Mduzana, and to Mr. Mashudu Mpohoni. And before I open the floor for discussion, I do just want to go back and correct something. And that is in the beginning, when I just in a jumbled way introduced and greeted people, I omitted to mention that the Dean of the Faculty of Medicine and Health Sciences at Walter Sisulu University is with us, Professor Jabu Mbokazi. A very warm welcome to you, and we feel very honored to have you in our midst. Thank you for joining us today. And so I want to open the floor for discussions. There have been some questions in the chat, and I see some of the answers have already been given. The speakers have been very on the ball and have already answered. So I just want to check whether the question by Mrs. Mart, has your question been answered? Mrs. Mart, you have placed a question to Sarona about bridging the gap of providing the most appropriate assistive devices with what is available, and do you have any insights on the policies that have been reviewed or being implemented? How do we bridge that gap? And I see Sarona has in fact written a very comprehensive response to that. Any comments?
I just want to say thank you. I think that very in-depth answers everything. So I'm good. Thank you.
Thank you. And thanks, Sarona. And then James Animayu Muzaala had a question or had several questions, mostly to Kubela, to Prof. Kubela Mg. And I see Prof. Kubela has already written answers. Are those questions answered, or do you need some time on the floor for that?
Yeah, thank you so much. I think the questions on assistive technology, I requested a response from Dr. Sarona and Mr. Meduzuna regarding, I'm following up actually on the question of comparison between the private sector prosthetics and the public sector prosthetics. And I was wondering what kind of the public funding model would facilitate access to quality assistive technology for people within the public sector. What should be done? What you know, in terms of making sure that there is equitable access to quality assistive technology that facilitates full participation. And then the other second question is for Mr. Mashudu, which is around it, on curriculum. He talks about one size does not fit all in terms of a curriculum. So my question is, what type of design does he recommend in terms of that facilitates one size fits one and expand to many, between universal design as a design for all without a need for adaptation, and people-centered inclusive design as a design that considers equity, justice, human diversity to facilitate full participation and well-being. So I just wanted to pick his thoughts and opinions in terms of expanding more on what one size fits all and what are the implications on design of the curriculum and other education system. Over to you. Thanks.
Thank you. So maybe we can give Lupiwo an opportunity to answer the first question, and then Mashudu,
okay.
The second question.
Thank you, Prof. In answering the question, to be specific, last week, Friday, we had a national forum where there was all the universities that offer the BSc in prosthetics and orthotics. We had all the deputy directors, we had the Superintendent General for Health, it was quite a huge forum. And in the forum, one of the resolutions is that there's a need for a national orthotics and prosthetic contract. So currently the provinces, they purchase separately or independently. Now, what we are trying to do is to have one basket where we can be able to, as provinces, collectively motivate to National Treasury to say, these are the kind of things we want. So we are sort of like moving towards a joint voice, a unison voice. So that is what is coming up, and we are hoping with NHI also coming up, there's going to be a change, because how this affects us as universities is that as universities we try to train our students at high end. Now the contradiction there is that when they then go practice or work in the public sector, the technology changes. So we're also trying to bridge that gap. So there are talks and advancements towards that, and we're hoping that in a few years' time that's going to change. Thank you very much.
Thank you. Before we go on to the question for Mashudu, can I just ask Sarona, would you like to add something to that?
Thank you, Martha. No, thank you, Lupiwa. I don't want to add. I think I have sort of also in the chat when I answered the question. Yeah, I've shared my ideas on it, and to me, a lot of it is regarding knowledge from a lot of different levels. So yeah.
Okay, thank you. So over to Mashudu. And Mr. James, if I can maybe ask you to repeat your question briefly to Mashudu. To Mr. Mambo.
Yeah, thank you. I actually wrote it in the chat, but I can repeat it. So Mr. Mashudu presented around one size does not fit all in terms of curriculum as one of the responses to having inclusive higher education system. Mm-hmm. And I want to know his opinion in terms of the implications on design of that. So what ideal design should be adopted by higher education institutions, education practitioners, between universal design as a design for all without the need for adaptation, or person-centered inclusive design as a design that considers equity, justice, human diversity to facilitate full participation, or any other design outside this. So it might be other designs, by the way, but just wanted to pick his thoughts in terms of being concrete, in terms of what one size does not fit all means in terms of design.
Okay, thank you, Mr. James, for the question. I really appreciate. You know, sometimes when you are working, you see all these things, and you can say, I'm working as a physiotherapist or an OT, but what happens if I become affected with a disability? Do I stop working or not? Obviously, you don't stop. You go on working. You get what we call reasonable accommodation at work. So if a person with a disability can be reasonably accommodated at work, is it not possible to reasonably accommodate a person with a disability or a physical disability at an institution of higher learning or not? That is the question that I keep asking myself. But all in all, yes, my opinion is on the universal design, so that everybody can take part. Everybody can take part. Most of the requirements in most courses, they require, there's cognitive requirements, there's physical requirements, there's also psychosocial requirements. You find that these people with disabilities, they only lack one thing, and they are not able to access that study program because of one physical requirement that they may not be able to meet. So what I want to put across is is it not possible to reasonably accommodate them in such a way that they can study all aspects, they meet all other aspects of being included in the learning programs? I hope I have answered your question, or maybe some of my colleagues can expand. Thank you.
Thank you, Mashudu. I do want to go on. Anya Maposo Mupawose has a hand up, so I would like to give her an opportunity to ask that question or to make the comment.
Thank you, Martha, for saying my last name correctly. That's how it's said. This is just a comment. Basically, from the discussion, I want to firstly say thank you so much for hosting such a lovely webinar. And it's important that we have discussions around social determinants of health and disability. And and I just wanted to comment, and I think is it Prof. Jill's presentation on Indigenous, that case study on Indigenous knowledge or methods, actually kind of alludes to or adds to what she's saying, that we do need to be careful sometimes when we're in the helping professions, that our knowledge base has been professionalized. And by that I say it's generally come out of a Western medical disability kind of approach, which tends to be deficit based versus using a critical model to address disability. And by critical model, I'm looking at it more in terms of, and I think the previous speaker alluded to this as well, the geopolitical dynamics that that are involved in the interplay of social health determinants, and also the episteme, who has the knowledge power when we're disseminating or assisting the clients that we have. Whose definition of disability are we using when we are addressing the social determinants of health and how we can assist so-called people with disability? Because disability is different for different peoples, and especially the Indigenous populations that we work with. So I just wanted to bring in that aspect, that we tend to focus on the body function structure impairment instead of taking it a bit further, looking at the causes in terms of geopolitical and epistemological power and knowledge. Thank you.
Thank you for those comments, Anya, if I may say so. Yeah, I think we have all, those are very valuable additions and food for thought, more food for thought. So thank you for that. Are there any more questions or comments from the floor? Or from the speakers? And there's a hand. Prof. G. Kubela.
I just want to affirm Ania for her comments, and I was just listening to her as she is speaking about the geopolitical issues of health, but more so the geopolitical issues of knowledge and whose knowledge is respected, and how can we use a more integrated approach to knowledge systems so that the health and well-being of our communities can be further enhanced. So thank you very much, Aniha.
Thank you, Kubela. I would like to ask Professor Mbokazi whether you would like to add something or whether you have a parting shot for us. It's just such a privilege to have you with us. So if you're still with us, is there a parting shot that you would like to give to this meeting? Okay, I don't. Professor Mbokazi, are you still with us? We'd like to give you the opportunity to give us a parting shot before we part, but perhaps he's been called away. In that case, I would like to. Okay, if there is someone else who still has something urgent to say, please do mention it. But we also do want to close the meeting in a timeliest fashion because we know that people have sacrificed time to come. May I ask Chanel just to quickly go onto the slide with our contact details, please? Thank you. What I want to stress is that this conversation today is literally the first step in or a early step. It's not the first step, but an early step in a conversation about the social determinants of health and disability, and it's by no means the final word. We are very, very aware of the many cans of worms that we've opened today and that we've only touched the surface with our snapshots, and that there are many more snapshots and that we could go much, much deeper. And so we would like to invite you all to contact us with questions, comments, further ideas, and so forth, and make this an ongoing conversation. And our contact details are all on the screen, and the meeting has been recorded, so the recording will be available. And then I just want to point out that Chanel has posted in the chat the opportunity for people for attendance, just to give some feedback on the meeting, and also everybody who would like to claim the 1 CPD point, please fill in the details on that form. So higher up if you scroll up in the chat, those 2 documents are available there. And on that note, I would really like to say thank you very, very much to the 4 speakers, to Kupelam G, to Sarona Fisachi, and a very, very humble apology to Sarona for mixing up her slides. I really am sorry about that. And thank you also to Lupiwo and to Mashudu and to Chanel for all the work behind the scenes and here in the meeting. And thank you to everybody for attending. And we look forward to hearing more from you. Thank you. Goodbye.